Tasha. Hi, this is the Ways and Means Committee. It's nice to see you all again. It's been a bit of time since we were last gathered together. It is 2:30 on the 21st, and we are looking at S-190. It was amended by the Committee on Appropriations, and Jen is kindly here to take us through that amendment. Great. And before anyone asks, the vote out of appropriations was 11-0. Getting ahead of you, Representative Higley, for once. Jen.
All right, Jen Carvey, Office of Legislative Counsel. We are looking at S-190, specifically at the Appropriations Committee amendment. Some of this will look very familiar to this committee. You may remember this bill, as it looked at it the other day, is an act relating to the Green Mountain Care Board, reference-based pricing, and studying the creation of a public employee health benefit authority, although the title of the bill changes at the end of the House Health Care Committee amendment because there's nothing about the Public Employee Health Benefit Authority in here. So it just becomes an act relating to reference-based pricing and the Green Mountain Care Board. But for the moment, it's still that longer title. And the Appropriations Committee did a couple of things, and some of it will look very familiar because you may remember we talked about an amendment from several members of the House Healthcare Committee that made some changes to Section 2 of the bill that came over from House Healthcare, and then struck out Section 3 and made some corresponding changes in the effective date sections. All of that amendment has been incorporated into the Appropriations Committee's amendment, and then they have one additional instance as well. So the first instance of amendment is doing that, striking out of Section 2 of the bill as recommended by House Healthcare and putting in the same language. The only thing I did was clarify that board means Green Mountain Care Board in the first time it's used. But this is limitations on hospital reimbursements for qualified health benefit plans and plans covering school employees, the VHI plans for hospital fiscal year 2027. And if you remember, this language took out the specific percentages and numbers for fiscal years 27, 28, and 29, and put in a standalone session law provision just for hospital fiscal year 2027 that said, notwithstanding any provision of the statutory language directing the Green Mountain Care Board to do rulemaking before they can do rate setting, the board may do reference-based pricing, order hospitals to reduce their commercial reimbursement rates for qualified health benefit plans and the VHI plans based on a percentage of the Medicare adjusted base rate determined by the board for items and services delivered in Vermont to enrollees in those plans. So
For the sections that we've seen already, we can just do.
okay, I just wanted to make sure because the different versions had come through. So that is that section. The second instance of amendment is striking out Section 3, which was the change to the outpatient prescription drug cap that was going from 120% to 130%, and that section was coming out in the Representative Black and others amendment, and this does that as well. The new piece, although it's not brand new because it's been in some budget language, but this would add in a new reader assistance heading and a new section, and it's moving the authorization for the Department of Vermont Health Access in consultation with the Department of Financial Regulation, that authority to seek a Section 1332 waiver to establish a reinsurance program and to seek federal pass-through funding of amounts attributable to premium tax credits, which is part of what's available in the 1332 waiver. So it's moving that from the budget to this bill. And then fourth is making that change in the effective date section that Representative Black's amendment had made as well. That's it.
What if you don't get approval for the waiver? What happens then?
We don't get approval for the waiver. I mean, it's just authorizing them to seek it. It doesn't mean, it doesn't mean we get it. We don't get it. You know, we're continuing to seek various ways to reduce the cost of health insurance. So.
Representative Wilkins.
I'm sorry, I think you said this. Who requested this additional language?
This came from the House Appropriations Committee, but it's language that has been in the budget.
Okay,
And the original request actually came from the governor.
okay, that's what I was trying to do.
Yes.
So it came from the
Yes.
government.
Yep. Yes, came from the governor's budget. And we revised the language a little bit in myself.
Representative.
That reinsurance waiver
Yeah.
waivers from the governor's budget.
So this who's this include for the VHI and
Yes, this is still looking
employees?
at VHI and the qualified health benefit plans for the reference-based pricing for hospital fiscal year 2027, while the rulemaking is happening for reference-based pricing more broadly.
Representative.
Thank you. So so in March, the Green Mountain Care Board said, cut at least 1% from your hospital budgets and now put your budgets together and we'll see you in August with your proposed hospital budgets. And I think that the Black Amendment said, we will not be asking you to adjust your budgets as a legislature more than what you've been asked to do by the Green Mountain Care Board. Is that correct?
So that may have been part of the explanation, was not having the legislature determine what hospital budgets should look like and leaving that to the Green Mountain Care Board, and that's what this amendment does. It doesn't specify a percentage of Medicare or a set dollar amount to be targeted, which was what the bill as it came out of House Healthcare did, but instead allows the Green Mountain Care Board to use targeted reference-based pricing for those plans for fiscal year 2027.
So they would be able to make even more cuts than the 1%.
Well, they can now. I mean, that's guidance for how hospitals should prepare their budgets, but the board makes the budget orders based on the criteria in statute that's looking to kind of balance access and affordability and sustainability.
That's true in current law.
Yeah. I mean, the board has the discretion now based on the criteria, the general criteria and statute and the hospital budget rules that are in effect to set budgets as they
Well, that's what I thought.
deem appropriate.
But this is protecting the hospitals from the legislature saying it has to be any more than that, what the Green Mountain Care Board has already determined.
It's just taking a legislative determination out of it. It's leaving it to the Green Mountain Care Board to
That's the
set
intent.
budgets, and it is authorizing the Green Mountain Care Board to order reductions to specific commercial reimbursement rates for the qualified health plans and the VHI.
It's taking the legislature out of it, the rates,
Yeah.
budgets.
If I may, I think the Black Amendment eliminated the 3.5% net patient revenue from hospitals to redirect resources. So this just continues that construct.
So the Black Amendment the House Healthcare version was taking a sort of defined dollar amount, which was 3.5% of commercial net patient revenue from a subset of hospitals, and using that to kind of back into a reference-based price based on that dollar figure. This is getting rid of the concept of identifying any dollar figure upfront and leaving that to the Green Mountain Care Board to determine.
Okay, I'm okay with this.
Did you still have?
I just wanted to clarify from the perspective of this committee what our stake is in this particular amendment.
Very, very nominal.
That was my understanding.
Thank you.
Jen, can you tell me what's the advantage of taking people's voice out of this? If we take the legislature out, we represent people, Vermonters, who are going to work every day. Some of them get health insurance, some don't have health insurance. What's the advantage to Vermonters by taking the legislature out?
I'm going to defer to the chair of House Healthcare because that sounds like an argument for the amendment, and I'm not in a position to tell the amendment.
Can you hold that question for a minute? So you hear from Nolan when we're done, Jen. Okay. Anything else for Jen?
Only if Jen wants to talk about reinsurance.
No.
Okay.
You and Jen can have a long conversation about it later. Yes, Representative Hilton.
It's so pedantic.
No.
We have a number of amendments.
Yes, there are fewer amendments now on this one. So now, because the Representative Black and others amendment has been incorporated into this House Appropriations Committee amendment, there will be the report of the Committee on Healthcare, which is one amendment, and the report of the Committee on Appropriations, which is another amendment. That's it, unless people have floor amendments. So yes, I think the part that may be,
So the other one is gonna go away. That's.
if this amendment is adopted, I think you may want to talk to colleagues about the sequencing of things, because the bill, this committee's review came before the Appropriations Committee's review, so I think technically you're reacting to the House Healthcare proposal, whereas you may have feelings about the House Appropriations.
Again, you know, this bill's been through a lot of different, you know, processes, and so for clarity for me, the Black amendment that we're talking about, that's pretty much incorporated in here, had a vote out of healthcare, correct?
The Black amendment, informally, because it was framed as a floor amendment.
Yeah, so the straw poll was,
740.
thank you.
And may I just add that we have not had the opportunity, House Healthcare has not had an opportunity yet to look at the Senate, the House Appropriations Amendment, so we haven't looked at that yet.
Thanks. Any other questions for Jen?
I hate to belabor this, but so the 7.4 is not what we're looking at. What they voted on 7.4 is the one before, the version before this one.
So the 7.4 amendment is instances 1, 2, and 4 of this amendment.
Okay.
So there were 3 instances of amendment in Representative Black's amendment. Those have been incorporated in here with a 4th instance.
Okay.
And this full amendment was voted out of appropriations 11-0.
Yes.
Okay.
Okay, if there are no more questions for Jen, I'm gonna go to Nolan.
I have to go to another.
Enjoy yourself, wherever you're going.
When is this showing up on the floor?
I have no idea.
If it's tomorrow, I'm good.
Okay, it might be today. I really don't know.
Okay, we need to.
I don't think this one's happening today.
Great.
Okay, that's all I need.
My committee will hear this tomorrow, at 9 a.m.
Nolan, do you have enough to say in the chair? Do you want to just say it from here?
For the record, first of all, I wasn't expecting to testify because I wasn't actually invited,
Great.
so I didn't know.
I know, but you were sitting there, so,
Okay, I don't have anything new to add.
okay, great. So there's,
Nothing new to add that I haven't already said.
okay, can you remind us what you said last time?
Sure.
Okay. I remember saying that I remember you saying there were quite unknown impacts, though it could reduce education fund spending. We don't know about that for sure because we don't know how locally voted budgets will go. Is that what you said last time?
What else did I say?
That's all I remember.
And then, the other was just the outsourcing provider tax stuff, which we already covered.
Oh, yeah, okay.
And then the only other new thing is just the reinsurance language, and that's just, taking out the budget. And to here, and that just gives the administration authority to pursue a 1332.
So what's a 1332 word?
Sorry.
So, generation comes to try.
Yes, you should.
So the 1332 waiver is under the Affordable Care Act. It was created under the Affordable Care Act. And it's like an innovation waiver. And it was thing that was added as part of the Affordable Care Act to encourage states to come up with innovative ways of coming up with stuff. For instance, if Vermont had pursued a unified and universal healthcare system under Act 48, we would have needed a 1332 waiver in order to do it. So one of the things when it was touted and still is being touted by all the previous administrations is this idea of doing reinsurance on like QHPs, et cetera. So the idea behind it would be that we can achieve savings and the federal government will allow us to reinvest those savings into things X, Y, and Z. That's how the waivers work. So reinsurance is one of the popular, no, I shouldn't say popular, because not a lot of people are doing it, but it has been done as an area that many states have looked to do 1332 waiver, to try to bolster the system.
It's a backstop for the insurance.
Yes.
Policies, right, in case they.
Basically, the reinsurance is, and so, but reinsurance costs money.
Yeah.
And so the idea behind it is if you're can find a way to achieve savings, then you reinvest that savings to do things like cover costs of reinsurance. The thing I don't know the answer to is, and I believe states have to have some financial skin in the game in terms of our own state budget dollars. I don't know what that would be or how much that would cost, but as part of this piece about pursuing the waiver, that's part of what the administration will be looking at. Like, what is the state?
Okay.
What would be the, if it's required, and what would it be?
So whoever came to pass, and we would know what the state's exposure would be. based
Yeah,
on-
they'd have to come back to us part of the process.
Great, thank you.
Thank you. Someone? There was a question for Chair Black. You still have that question, Representative Brennan?
I forgot what it was. No, couldn't have been.
Okay. Does anyone need anything else on this?
Was that question about what, if we take the legislature out, so there's no more voice for the public, does that hurt us? How does it?
Oh, that's an interesting question philosophically. Representative Black, do you want to?
You understand what I mean?
I do.
Okay.
I do understand what you mean.
Does it help at all or not?
Well, what the original underlying bill did was it inserted the legislature in an already well regulated, thought out, rule-based process that happens each and every year between our regulator, the Green Mountain Care Board, and hospitals. And the reason I offered the amendment, I will tell you, we passed it out of House Healthcare. And then the hospitals came and they said, we want that may to be a shall. And what that would have done is it would have essentially said that those thresholds we had put in there, that was tying the Green Mountain Care Board to exactly what they would have in their budget orders. And those numbers were just these sort of flexible, everybody working together because hospitals were involved in trying to get to these numbers. And we don't do that. We have tasked the Green Mountain Care Board with this regulatory authority. And I will just say, I mean, it works well. Everyone knows the process. It would have put the legislature into prescripting exactly what the board would do. And the other important thing is by having those numbers in there, that is what they would have to do across the board. I think Representative Odie mentioned the budget guidance this year was generally -1%, but that's actually not true because they gave different hospitals different guidance. And by putting these prescriptive amounts in there, they would have not been able to actually tailor what each individual hospital budget orders would be after going through a very lengthy process. And this actually allows the Green Mountain Care Board to do what the Green Mountain Care Board does and is highly skilled at doing. They have amazing people there that do nothing but hospital budget guidance, and every hospital has highly skilled people. That is what they do. And they can now take each individual hospital budget order, and this just says, you may use those savings and you can help these two markets that are under incredible stress. And you can help these two markets that will help so many Vermonters and frankly, the most Vermonters.
And how do people get on the Green Mountain Care Board?
Green Mountain Care Board has it's all in statute, the nominating committee. There is a Green Mountain Care Board nominating committee, which has representatives from the Senate, from the House, from the governor, from, I can't remember all the other,
People.
yeah. So, yeah, so there is a very lengthy process of choosing people, and then those people who the Green Mountain Care Board deems qualified, those names are submitted to the governor, and then the governor may pick from those names, and that's how people get on the Green Mountain Care Board.
Oh, yep. Mhm.
So is it, for some people, it's not a full-time job, but a full-time job for.
It is a
Full-time.
full-time
I thought
job.
it wasn't, then I thought, no, there's a professor.
Yes, well, some of them have side gigs, I think.
80%.
80%, yes. But Representative Goldman is on the Green Mountain Care Board nominating committee.
80%. Oh, thank you.
And I don't think you identified yourself for the record.
I am so sorry. Representative Alyssa Black from House Healthcare.
Thank you.
Do we have any hospitals that are on the Green Mountain Care Board? Any hospital representation? I don't remember. It's,
We heard about the healthcare committee.
Well,
I know, but I'm just
Okay.
curious. I mean,
you know, it would depend on what the Green Mountain Care Board put forward to be nominated and to the governor. I guess, should a hospital be on the regulator that regulates hospitals?
you know,
And-
try to-
A second.
Yes.
Thank you very much for being here.
Thank you. Thanks for hearing this.
So I'm going to remind folks that the fiscal impact, the revenue of the state, the impact of the revenue of the state is that it is possible there will be a downward pressure on the education fund and property taxes because of that. That is the sort of big picture summary for us. Though I know that there's lots of policy in there. If folks would like for us to wait for our straw poll, so appropriations voted this at 11-0. If folks would like to wait for the straw poll until after House Healthcare meets on this tomorrow, we can, though scheduling feels like a little bit of a nightmare lately. So we would probably take that vote on the floor in a little huddle rather than doing it all right here.
Today.
No, it would be tomorrow.
I feel like,
Yes.
I feel that, although I'm ready to vote now, I want to make sure I know what they really finish with. And so I'm okay with huddling tomorrow.
Okay, everyone. Okay. So we're going to, Jim.
I just apologize for being late. I went down to Ledge Lounge and turned off my ringer and,
Okay, great.
but I'll catch, thank you and I'll catch up.
Okay. So that seems like another vote for, so we're gonna stop here. Everyone's gotten the full information that we're gonna do in committee. We'll do a huddle on the floor for a straw poll on this tomorrow. Sound good?
Sounds good.
Okay, thank you. I do believe we're gonna have one more bill that we're gonna need to schedule for tomorrow. I think maybe it was at 9:30, but I don't remember what I told Autumn, nor do I remember what the bill was, but there will be an email coming to you soon. See you then.